Welcome to Nurse Vivian page. Do well to subscribe, share and comment.
Welcome to another episode of Health Talk with Nurse Vivian. Today we will be looking at depression and how you can manage it. What is depression? Depression is a mood disorder that causes a persistent feeling of sadness and loss of interest, also called major depressive disorder or clinical depression. It affects how you feel, think, and behave and can lead to a variety of emotional and physical problems. You may have trouble doing normal day-to-day activities, and sometimes you may feel as if life isn't worth living, more than just a bout of the blues. Depression isn't a weakness and you can't simply snap out of it. Depression may require long-term treatment. But don't get discouraged. Most people with depression feel better with medication, psychotherapy, or both. Symptoms. Although depression may occur only once during your life, people typically have multiple episodes. During these episodes, symptoms occur most of their day, nearly every day, and may include feelings of sadness, tearfulness, emptiness or hopelessness, angry outbursts, irritability or frustration, even over small matters, loss of interest or pleasure in most or all normal activities, such as sex, hobbies or sports, sleep disturbances, including insomnia or sleeping too much, tiredness and lack of energy, so even small tasks take extra effort, reduced appetite and weight loss or increased cravings for food and weight, worthlessness or guilt, fixating on past failures or self-blame, trouble thinking, concentrating, making decisions and remembering things, frequent or recurrent thoughts of death, suicidal thoughts, suicide attempts or suicide, unexplained physical problems, such as back pain or headaches. For many people with depression, symptoms usually are severe enough to cause noticeable problems in day-to-day activities, such as work, school, social activities, or relationships with others. Some people may feel generally miserable or unhappy without really knowing why. Depression symptoms in children and teens. Common signs and symptoms of depression in children and teenagers are similar to those of adults, but there can be some differences. In younger children, symptoms of depression may include sadness, irritability, clinginess, worry, aches and pains, refusing to go to school, or being underweight. In teens, symptoms may include sadness, irritability, feeling negative and worthless, anger, poor performance or poor attendance at school, feeling misunderstood and extremely sensitive, using recreational drugs or alcohol, eating or sleeping too much, self-harm, loss of interest in normal activities, and avoidance of social interaction. Depression symptoms in older adults. Depression is not a normal part of growing older, and it should never be taken lightly. Unfortunately, depression often goes undiagnosed and untreated in older adults, and they may feel reluctant to seek help. Symptoms of depression may be different or less obvious in older adults, such as memory difficulties or personality changes, physical aches or pain, fatigue, loss of appetite, sleep problems or loss of interest in sex, not caused by a medical condition or medication, often wanting to stay at home, rather than going out to socialize or doing new things, suicidal thinking or feelings, especially in older men. When to see a doctor. If you feel depressed, make an appointment to see your doctor or mental health professional as soon as you can. If you're reluctant to seek treatment, talk to a friend or loved one, any healthcare professional, a faith leader, or someone else you trust. When to get emergency help. If you think you may hurt yourself or attempt suicide, call 911 in the US or your local emergency number immediately. Also, consider these options if you're having suicidal thoughts. Call your doctor or mental health professional. Reach out to a close friend or loved one. Contact a minister, spiritual leader, or someone else in your faith community. If you have a loved one who is in danger of suicide or has made a suicide attempt, make sure someone stays with that person. Call 911 or your local emergency number immediately. Or, if you think you can do so safely, take the person to the nearest hospital emergency room. Kindly subscribe, share, and comment for more informative health talk.